dentures.
Which means, what does it mean? Ain't she sweet? Bees would not be buzzing round her if she was.
I just finished reading the Dogma article as well as the Wiscott article about why teeth are put in the place that they are, and also the dogmas that may be holding us back from treatment that's proper for our patients. And what's interesting about the dogmas is that they're things that have been taught in dental school for years that may not have any significant evidence that they're effective. So from that article, I remember reading about a face bow not being needed in the fabrication of dentures. And this is something interesting because people have thought about that. And also about the simplified technique versus the academic technique. There's a lot of evidence showing that patients aren't able to tell the difference. And therefore, sometimes it's best to just do what's quickest so that you can be a productive clinician. Also, in the Wiscott article, it talked about the position of the teeth and how they are confined by the lips and the tongue to be in the right position, and also they erupt and will find the opposing tooth. However, there was really interesting thing talking about how there only needs to be one contact point in order for there to be good occlusion. And this is going against a lot of what you'd usually think. And so in the fabrication of dentures, we can follow these. And in the future, we need to look for more evidence-based of what is going to ultimately be the best for the patient and for the clinician. Here are some thoughts that I have after watching the TED Talk about prosthetic limbs, is that in the dental world, everybody's jaw is so different and so unique. So here is an idea that I have that could maybe advance prostheses for the mouth. And that would be that we could find a way to simulate the movement of the patient's mouth. Something that could hook up to a computer that would simulate so you could see the movement, so we could know exactly what the best balance for that person would be, and then be able to use maybe like a CEREC machine that makes crowns or something that would be able to produce a perfectly fitting denture that could go on implants or something, but that would simulate their mouth individually. And in patients that aren't able to have prosthetics, we need to find a way that they can have them. So my idea, it would be integrating with a computer to make these prosthetics that are unique to that individual person. And that would maybe even be more accurate than an impression. So eventually maybe that could be the way things would go. I'd love to see the changes that will happen in prosthetics during my lifetime.